In Chapter 2, we're going to look at the important thrombolytic drugs. Thrombolytics are drugs that are also known as fibrinolytics, and some people actually just refer to these as clot busters. These drugs are designed to break up the clot, and they are going to catalyze the conversion of plasminogen to plasmin. Plasmin is a serine protease that will break down the clot. Important drugs here include TPA, tissue plasminogen activator. We're also going to mention streptokinase. These drugs are very important for short-term emergency management. When a patient gets a clot, for example with an MI, a DVT, a PE, or stroke, we want to use these drugs very quickly for their life-saving benefits. When I compare streptokinase to alteplase, note two very important differences between these drugs. Streptokinase acts on both bound and free plasminogen, whereas alteplase is very clot-specific, acting only on plasminogen that is bound to the clot itself, fibrin-bound plasminogen. The second difference here is that streptokinase comes from a bacterial protein. It's antigenic, whereas alteplase is naturally occurring, so there's no allergy problems. So between the two, it's a pretty obvious choice for going with alteplase. It's a very, very popular thrombolytic drug. This diagram looks at the action of streptokinase and alteplase. Remember, the important part of this reaction is that they're going to catalyze the conversion of plasminogen to plasmin. Plasmin as a protease is going to degrade the clot. When we consider the clinical features of these thrombolytic drugs, most importantly, give them as soon as possible. If you give them as soon as possible, they're most likely to be life-saving. Of course, the complication from a drug that breaks up a clot is going to be bleeding, possible hemorrhage. How do you stop the actions of these drugs? With anti-fibrinolysin drugs like aminocaproic and tranexamic acids. These are possible antidotes in excessive bleeding, and the way that they're going to work is they're going to stop the conversion of plasminogen to plasmin.